Buspar tablets is used to treat anxiety. It may help you think more clearly, relax, worry less, and take part in everyday life. It may also help you to feel less jittery and irritable, and may control symptoms such as trouble sleeping, sweating, and pounding heartbeat. Buspirone is a medication for anxiety, anxiolytic, that works by affecting central natural substances in the brain, neurotransmitters. Indications. Buspirone hydrochloride tablets are indicated for the management of anxiety disorders on the short-term relief of the symptoms of anxiety. Anxiety or tension associated with the stress of everyday life usually does not require treatment with an anxiolytic. Generalized persistent anxiety of at least 1 month continual duration, manifested by symptoms from 3 or the 4 following categories: motor tension, autonomic hyperactivity, apprehensive expectation, vigilance and scanning. Dosage and administration. The recommended initial dose is 15 mg daily. To achieve an optimal therapeutic response at intervals of 2 to 3 days, the dosage may be increased 5 mg per day as needed. The maximum daily dosage should not exceed 60 mg per day. In clinical trials, low dose titration, divided doses of 20 mg to 30 mg per day were commonly employed. The bioavailability of buspirone is increased when given with food, as compared to the fasted state. Consequently, patients should take buspirone in a consistent manner with regard to the timing of dosing, either always with or always without food. Contraindications. Buspirone hydrochloride tablets are contraindicated in patients hypersensitive to buspirone hydrochloride. Precautions. Before taking buspirone, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. This medication should not be used if you have certain medical conditions. Before using this medication, consult your doctor if you have kidney problems, liver problems. During pregnancy, this medication should only be used when clearly needed. Tell your doctor if you are pregnant before using this medication. Discuss the risks and benefits with your doctor. Side effects: dizziness, drowsiness, headache, nausea, nervousness, lightheadedness, restlessness, blurred vision, tiredness, and trouble sleeping may occur. If any of these effects last or get worse, notify your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects.